Okay, everyone, this is Dr. Amigues, your friendly rheumatologist. Today, I wanted to discuss lupus, so systemic lupus erythematosus, and we're actually going to discuss what it means, so you come out of this with a better sense of what this is, okay? And as you know, I really like to tell stories because I think they really make more sense about what everything is and why us rheumatologists understand the different variation of what lupus can be. And you're going to see, like, you can have a very mild lupus, you can have a very severe lupus. I'm going to start with a story, okay? So I had a patient. So when I was a fellow at Columbia University, we were doing inpatient, so you're seeing patients in the hospital, and I was called for a patient that had multiple seizures, and he had so many seizures. So it's like epilepsy when your brain just fires up, and then ultimately you just can't function. You may develop tremors. You probably have seen or have heard of that. And anyway, so he had developed seizure, and so much so that he actually had to be put in a coma so that we would stop and relax his nerves, his neurons, so that they would not fire up like this. So he was in a coma when I saw him. And the reason they had contacted rheumatology was that he had some protein in the urine, and there had been in the past a positive ANA. And so they were wondering, is it possible that what he has is due to lupus? I'm going to fast forward. It was lupus, and it was a severe lupus in the sense of the lupus had actually affected his vessel as well as his brain. And so he had very severe lupus that, and also his kidney. So he had brain involvement, kidney involvement, and in addition of like what we learned later was joint pain. Okay, so joint involvement. Don't worry, it's a very good story. So anyway, so every day I go in and I'm, I have this thing where I talk to my patients because I love talking. I guess that's the reason. Also because I do think that patients hear. And so, otherwise you're just like hanging out around a patient that's in the coma. It's better to just talk, right? And so, oh, hi, so-and-so, this is Dr. Amigues. Today is this day, and every day you're doing better. Because why not? Because every day he was doing better, right? And so I say this, and then he wakes up, he gets out of the coma, and he had the most beautiful half smile. Because what had happened is that because of the inflammation he had in his brain, he had developed a stroke. So he had inflammation in the brain that led to a stroke and led as well as epilepsy. So we had taken care of the seizure. Actually, it's better to say seizure. So we had taken care of the seizure, and we were taking care of the stroke. And basically, underlying was all of this inflammation we were supposed to, we had to take care of, and we did. And here he is with his half smile. And what's really both uncool and at the same time cool, you're going to see, with lupus is that they usually affect young people. So it's uncool because if you're young, you would rather do something else than have to deal with medical issues, of course. That said, I think that it teaches you a lot. It teaches you that, life is not given and it's a gift. And so you have to use it appropriately. But it's also cool because when you're young, you actually heal faster and heal better. So yes, you have more inflammatory disease, you have more autoimmune disease, but you also have more healing potentials. And so here is this patient who's hemiplegic. So what's like half of his face wasn't working, half of his body wasn't working. And I remember telling him, not being completely sure, but having read about neuroplasticity, saying, hey, even though you're not necessarily feeling your leg, maybe you're not necessarily feeling your face, just keep doing the exercise in your mind to create the connection so that the neuroplasticity works. And he did. And every morning I would come and see him, and he had this beautiful half smile, and it was just absolutely wonderful. And we put him on immunosuppression because that's really what it needed because of this lupus. And we give him all of the things that he needs to get on for lupus, and then he gets better slowly. He gets, and the day comes when he is supposed to be sent to rehab because basically acutely everything that we had to do was done, and now we needed to take care of his rehabilitation so he would be able to walk and things like that. And because of insurance, yay, insurance, right, in the US, he is not able to follow up with me in the clinic. And so he goes and sees another rheumatologist, but he comes back 3 months later. And, before that, the really cute story is that before, like, as I'm going to say bye to him and he's telling me, I really wish I could follow up with me, he basically takes off the sheet of his bed and he reveals his sneakers. And he says, look, I'm putting the sneakers on because, as you mentioned, I'm going to imagine that I'm able to run. And so every day I'm imagining that I'm running. And I'm doing this because you told me that I should, that I could, and I want to. And so he does that. And he comes back 3 months later and he's fully walking and is absolutely normal. And his lupus is in full remission. I mean, he's on treatment, but he's in full remission. And here is this man with probably one of the most severe presentation of lupus. He had kidney involvement, he had brain involvement, he had vessel involvement, that is fully functional, in full remission, despite having had to go through the intensive unit, the neurological intensive unit, despite having had to go through immunosuppression and rehab of a full, hemiplegia, like so half of your body that doesn't work and doesn't respond to you. If that is not the coolest story in rheumatology, I don't know what is. And I will tell you that when things happen to me in health, I very often think of him. He went on to do very, very well. And then ultimately had babies. And the last time I had news from him, he was just telling me that he had a second baby. So, just like this wonderful, wonderful story. And I think we should never, ever give up on patients that have a rheumatologic disorder, because our rheumatologic disorders, they respond to treatment. And yes, maybe at first it's a lot of immunosuppression, but we can back off later. So that is the cool story, okay? So now this is, oh, hi, Letty. It's so nice to see you. Rheumatology fellow, yay. I was just saying that I was missing teaching fellows. So that makes me so happy. Thank you. And thank you for putting that comment. So yeah, thanks. What was I saying? So yeah, so I just talked to you about probably the most severe case of lupus, right? That's definitely when it affects the brain, when it affects the vessel, we're talking about something really severe. But you have the other spectrum of just like very mild lupus. Maybe it affects just the skin, maybe it affects just the joint and so on. And so I just wanted to kind of go over this so that you understand when you're like, oh my gosh, do I have lupus? I want you to realize that having lupus doesn't mean that it's the end of the world, okay? So that's the message. If you want to go now, you can. But really, that is the most important thing. Even a severe case we can treat, and like definitely mild case we treat. Okay, so what is lupus? Lupus is an autoimmune disorder. So it is the autoimmune disorder, meaning that when in your body, you are in balance. We are very well done. And so there are immune cells that are really making sure that there is nothing in your body that shouldn't be there. So we're talking infection, cancer cells, and so on. You shouldn't have infection that are going to cause you harm. And you shouldn't have cancer cells because that potentially can cause cancer. And so your immune system gets rid of all of those. Basically, they say this should not be here. They send a signal, and your immune system, there's a second response that basically does inflammation and gets rid of those things that should not be here. When you have an autoimmune disorder such as lupus, what happens is that your immune system somehow is triggered. We don't actually know what it's triggered by, but it's triggered. There are some supposition that maybe it's triggered by some infection or things like that. But anyway, it's triggered. and we don't necessarily see the infection going on. We don't necessarily see anything wrong going on with your body. And so we say as rheumatologists, well, it's wrongly triggered because like it's considering cells as abnormal and it's trying to get rid of them by causing inflammation when really it should not. So you have this immune system that's kind of working in a way against you. That's and I don't like to use that word. I think it's just overly reactive. And so I always say we work with our bodies. So really with lupus, we have to tell your body like, hey, calm down. You don't need to be so hyperactive. Calm down. And it's like a toddler, like all over the place. Just calm down. You need to rest. You need to rest. Okay. So this autoimmune disorder is very interesting because it can affect all of the organs. Like absolutely everything can be affected in lupus. The most common are the skin. And I do this because it can be like what we call a malar rash, vespertilio. So you're going to have like this red here, can have red here. And usually you have this white here, like white because it's sparing the nasolabial fold. And really, why does it spare this? It's because it's a rash that's sensitive to the sun, even if you don't take actually a lot of sun, but there will be sun, and it's going to affect the DNA of the cell of the skin, and it's going to affect only the part that has in front of the sun, which is why you will not see it in the nasolabial area, because it's actually like it has less sun because of the shade. Okay, so that's the skin. It can do over skin the disorder. It can do ulcers in your mouth, in your nose, and it can cause skin like alopecia. So patches in your hair. You could have patches that are devoid of hair basically, and then you can look at other rashes. I really like to look at the ear because that can hide. Discoid lupus can hide in the ear. So rheumatologists, we always joke that we look at hands, feet, and ears. We really like that because there's a lot of information that come out there. So that's the skin. And of course, it does a lot more than just that, but that's some of the things, right? We don't say Raynaud's, which is the change of color of your fingers with cold. And so if you've had Raynaud's, because maybe one finger is completely white, maybe it's the whole fingers, but it's very delineated and like a sharp. Well, Raynaud is actually super common. I have it. And it's not considered an actual sign of lupus. It's just supportive because if you have Raynaud's, you're more at risk in certain cases to have an autoimmune disorder. So that's skin. Then we were talking about the alopecia, so loss of hair. But then the other one that's not really bad is the joint. So you can have what we call an inflammatory arthritis, and that can cause a lot of pain. And you can have a tendon issue, in the sense of like a very big difference between rheumatoid arthritis and lupus is that in lupus, usually you don't have this, first of all, you do not have destruction of the joint. And in lupus, you're going to have more tendon issue than you're going to have joint issue. You have both, but mostly it's like tendon. And so you can see something called Jaku arthropathy, where your fingers just they're not straight like this. And they look that they have like this curve form because the tendon are lax. And then you can actually put them back in place. And then there are other symptoms that are, more problematic. So if you just have joint, skin, and a positive ANA, you may have lupus, but it's not a bad lupus. Okay, so we as rheumatologists, our job is to make sure you don't have severe lupus, right? But it's not. But if it's just those symptoms, that's okay. The other ones that we're going to look at are the lining of your heart. So that would be pericarditis. So pericardium is the lining of your heart, and this is the inflammation. Okay, so inflammation of the pericardium, pericarditis, that causes pain, usually chest pain. Pleuritis, which is the lining of the lung, and that causes inflammation of the lining of the lung, and that's pleuritis. So that's pretty common as well. Also can cause chest pain, a little bit different type of chest pain, but it can also cause chest pain and thorax pain. And then you can then have involvement of your GI tract, You can have involvement of your brain, as we mentioned earlier. You can have involvement of your heart, like the actual muscle of your heart. You can have involvement of your lymph nodes, of your whole immune system, of your blood count, which are going to come down, and so on. And then the other one that's pretty common is that you can have involvement of your kidneys, which is problematic as well. So really, when you're looking at lupus, what you're thinking is this lupus? So that's really important. Is this in this lupus? And so the way we diagnose lupus is depending on criteria. Hi, Dr. Una, such a pleasure to see you. Such a pleasure. Hi, Nikki, such a pleasure to see you as well. So yeah, and so the way we're going to diagnose lupus is that we're going to take all of the regular, like all of the usual symptoms and signs of lupus, and experts that have come up together basically came all together to give some sort of numbers saying that if you have this, then most likely you have lupus. If you have this, you may, if you have another one. And so you have numbers associated with all of them. But that is how we will diagnose lupus. It's depending on what symptoms you have. And you have, one, the symptoms, and two, you have the antibodies. And we'll go into this more in details, but it's really just more like today is really the first part where I go over what are the symptoms, right? And so we talked about the skin, we talked about the joint, we talked about the hair loss, we talked about the blood cell count that can go down. So you can have low platelet, you can have anemia, you can have low white blood cell. Because of that, you can have more infection. Then you can have fever, you can have lymph nodes, you can have kidney involvement, you can have GI tract involvement, so blood in the stool, I've seen that, abdominal pain, you can have the pleuritis, and you can have even lung involvement. So really, when you're looking at lupus, it's like, okay, out of all, so if there's a patient here that's wondering, do I have lupus because you have a positive ANA? Remember, positive ANA doesn't mean lupus. And the second thing is like, okay, what symptoms do I actually have? And does that actually correspond to something that could indeed be lupus, right? And most of the time, I will say, most of the time, my job is to reassure patient that this is not lupus. And the second time, like the second thing that I do is that even if it is lupus, it's very mild, okay? Anyway, so I think I went way over the usual 15 minutes that I go to, but such a pleasure to see all of you. I hope it's getting more clear of what is lupus in the sense autoimmune disorder can affect almost every single organ, very common, affecting the skin, the joint, and that's usually associated with a positive ANA, but doesn't have to be. We will talk about this the next time. And I hope the story I told you at the beginning allows you to see the light that any patient that has a rheumatologic disorder should see, which is that even in the worst case, usually we have treatment. I will, the next time, so part 2 will be how we diagnose lupus. And then part 3 will be treatment of lupus. So come in, and I think you will like it. And I will tell you some stories as well. All right. See you then. And I hope you like this. Take good care. Bye-bye.